Well, welcome and good evening, everyone. Thank you for joining us for this special town hall hosted by the County of San Diego's Health and Human Service Agency and the San Diego Voice and Viewpoint. I'm Nick Macchione, the agency director for the Health and Human Service Agency, and my apologies of not being in person, having some technical difficulties. But I'm excited to be here with you, and I'm joined this evening by my co-host and friend, the esteemed Dr. John Warren, publisher of Voice and Viewpoint. I want to start by thanking Dr. Warren for this opportunity to have a candid conversation with the community about the work that our new Homeless Solutions at Equitable Communities Department is doing in the county and, more importantly, in the community. This town hall is part of a series to address important issues directly with you, the community. Over the last couple of months, Voice and Viewpoint has been gracious enough to host conversations about the county's child welfare services and behavioral health services. This evening, we have a brief presentation on the county's efforts to address several issues, including homelessness, equitable resources, and our newcomers, services to our immigrants, refugees, and asylum seekers. But we're not just here to share what we're doing. We want to hear from you, your questions, your feedback. We'll be using the question and answer function at the bottom of your screen where you can submit your questions and comments. We're going to spend a majority of the time addressing those. We also have interpretation services available in Spanish if you need it. You can select that option at the bottom of your screen. I'm sure many of you are here because you know that addressing homelessness is more important than ever. It's a regional, city, and neighborhood issue. No single entity can tackle it alone, nor has anyone been able to do it alone. San Diego is blessed with many community-based organizations who are providing critical services to people experiencing homelessness. To everyone who works with or for one of these community partners, I can't thank you enough. At the county, we've taken some big steps to make our system work even better for the people who need it most. This includes better supports for our critical partners and other local governments and our grassroots nonprofit organizations. The emphasis on prevention and supportive services has never been greater. And excitingly, new initiatives are underway with a board of supervisors who generally cares and supports on ending homelessness. Yet gaps still remain, and we're working on that and centering equity in our approach. This includes a commitment to better serve the needs of the Black community, of communities of color, and of those historically underserved. This includes pairing oversight of our homeless department with that of our Office of Equitable Communities, as well as our Office of Immigrant and Refugee Affairs to ensure collaboration and equity in action. The Community Operations Officer of our new Homeless Solutions and Equitable Communities Department, I know it's a mouthful, so that's why we call it HSAC for short, is Barbara Jiménez. And Barbara will speak more to this shortly, giving an overview of how we address issues of concern that impact the community's health and well-being. Look, tonight's a really important conversation. We can't thank you enough for taking of your own personal time to be part of it. And again, we appreciate the invitation and look forward to your questions. Now, I'd like to turn it over to Dr. Warren.
Well, Nick, I want to thank you very much. I'm excited to be here. This is just an extension of the partnership that we have with your organization and your team. You've got some great people working with you. I'd like to say I've been so excited about our past two sessions because one of the things we've done is put them online afterwards, and we put up people's pictures and telephone numbers. And so the folks dialing in, even if they missed this part, they can't say they don't know how to reach people. And we're just open. This is a priority with us. We did two issues in September, the 22nd and the 29th, addressing the new Continuum of Care report on homelessness among Black San Diegans, which is a rather powerful piece, but we're concerned and have been for years for homelessness across the board, especially the number of families that are involved. We work with Black Men and Women United with schools that we have adopted because of the number of children that are couch surfing. They're homeless. We're working with the Housing Commission and trying to find locations, and we've established pantries and shelters for them. So I'm excited about this meeting, and I'm excited about hearing from the people who are assembled here. And our interest goes far beyond tonight. I just wanted to share that, and I'm all ears. as we do this together.
Thank you, Dr. Warren. I think you're more than just ears. You're also
Nick,
action. So we appreciate you.
But Nick, I would be remiss. I've got to say something here because Tim has been so superb as a liaison and a person to work with. And he has really made our relationship with the county a true partnership. And, you know, we're kind of synced since we have been media buddies for so many years. But I'm excited that he's there. I'm excited about the people that you put together as a team. And I can tell all of you, as one who's been around this a while, it's exciting to see your faces and your spirits and personality. Because I remember when people before you didn't look like you and they didn't act like you. So it really gives me a booster shot. All right, I'm through, Nick.
Thank you, Dr. Warren. I know Tim appreciates that shout out, as we all do for your partnership. Now it's my pleasure to introduce the county's Homeless Solutions and Equitable Communities Community Operations Officer, Barbara Jiménez. Just a little bit about Barbara for those that don't know her. She has over 33 years of experience working within the county in the planning, the management, and the delivery of social and human services. Prior to her role in this capacity, she served as the Health and Human Service Agency's regional director for the Central and South regions for over 10 years, managing operations for public health clinics, child welfare services, community health, and public eligibility. Barbara is very passionate about working with organizations, particularly grassroots organizations and residents, to provide services and resources to the community. She has been there at every point in time count for homeless in the Central region, and I can go on and on about her passion and really making a difference for our most vulnerable. So with that, I'll pass it now to you, Barbara, to introduce the team members here with us tonight.
Thank you, Nick. I appreciate it. And I just thank you for the introduction. And again, Dr. Warren, I just really want to take another opportunity to thank you for the opportunity to be here tonight. Having had the pleasure of working with you for many years. You hold us accountable, you tell us how it is, but you're right there as a partner next to us, and that makes all the difference. And so we appreciate being here tonight. And I'm just really excited to be able to share with everyone an overview about this new department and provide an update on what we're doing. So let me just take a moment to introduce the team who's here with me tonight that make up the department. I have Jennifer Bransford-Coons here. She's our director for the Office of Equitable Communities. Deanna Beck, our director for the Office of Homeless Solutions. Lucero Chavez Basilio, she's our director for the Office of Immigrant and Refugee Affairs. Liberty Donnelly is our deputy director for administration for the department. And Crystal Skirvin, who many of you have met in the community and in previous sessions, is our regional community coordinator for the Central region. And I just also want to note really quickly, Elizabeth Bustos, who many of you know as well, and you'll hear a little bit more about Elizabeth's role as well. I'm just excited to have her here. So as Nick shared, you know, the Department of Homeless Solutions and Equitable Communities, also known as HSEC, is a new department. We officially launched on July 1st of 2021. And really, you know, Nick talked a little bit about this, touched upon it, but the vision really was not only about providing resources and support to address the needs of traditionally under-resourced and vulnerable groups, immigrants and refugee communities, and peoples at risk or at experiencing homelessness, but also was created to achieve that better coordination of existing and new county homeless and equitable community efforts, and really serve as a central point of collaboration for our outside partners to ensure equity amongst all San Diegans. I do want to note something, you know, that Nick mentioned was no one entity can do it alone. And really this department and that vision is to work with our partners and so many other organizations that are doing tremendously important and impactful work. And so this reorganization of resources and addition of new resources really was about improving our efficiency and effectiveness as the county expanded its regional leadership in areas such not only as homelessness, but also equitable communities and immigrant affairs. As I mentioned, or as you can see here, we have the three office. Equitable Communities really focuses on enhancing the community engagement and collaboration, and really devoting efforts to meeting the needs of our under-resourced communities. Our Office of Homeless Solutions focuses on really building that coordinated and robust homeless services system, increasing street outreach, case management, which is critical, cross-threading with programs to prevent those at risk of homelessness from becoming homeless. And then our Office of Immigrant and Refugee Affairs, very excited as well about OIRA, our Office of Immigrant and Refugee Affairs. We really was focusing on advancing equity and opportunities for immigrants and refugee communities. We are not new to serving refugees. We've had refugee coordinator and done a lot of work in this area, but really it's about coming together in a coordinated fashion, removing barriers, and really helping individuals integrate into society and thrive regardless of their immigration status. So, you know, as we begin this work, I just want to take a moment to acknowledge that it's vital that we acknowledge that there's significant health and economic disparities among our communities of color in our county. And these disparities are driven in part by a history of inequities within our system, barriers to information, lack of access to resources. And as Nick mentioned today, you know, and earlier, the gaps remain. And so we're working hard to reduce those gaps and really centering equity in our approach in everything that we do. Some of the efforts that we've taken to address some of these issues really include expanding the services, programs, and outreach within the Office of Homeless Solution to those at risk of or experiencing homelessness countywide. So what does that mean? What it looks like? It's our teams are out in the field daily. They're providing outreach and street-based case management. They're not only linking people to county services such as Medi-Cal, CalFresh, General Release, and CalWorks, but they're completing applications and determining eligibility for the programs in the field, which is very important. And oftentimes that is the first stepping stone to the self-sufficiency. Our Office of Equitable Communities, they're coordinating things such as communities in action programs, really helping community members by assessing what are the household needs. How are we providing supportive services for those in crisis? How are we increasing access to classes and workshops on things such as career development or domestic violence prevention? And then OIRA is overseeing our Refugee Employment Services Program, really ensuring and helping newly arriving families, making sure there's culturally and linguistically appropriate services that can help immigrants and refugees adapt to their new environments, and obtaining those important and critical job placements to become self-sufficient. This program alone was able to support over 1,000 individuals with getting paid employment last fiscal year. Another critical step that we have really focused on and really looking at how we reduce disproportionality and continue to increase trust with our community members is to ensure that our own employees and staff of this department is representative of the communities that they are serving. As you can see in this table, you know, we've made it a key priority to hire new staff and leaders with a strong emphasis on those who have lived experience for many of our roles. This includes hiring staff members who live, work, and play in the areas that they're serving. Many are from diverse communities, such as members of the LGBTQIA+ community, immigrants themselves, and refugees. And then we want to make sure also that, you know, that we have a plan and that we have a roadmap. So in efforts to really combat the significant health and economic disparities among our communities in our county, and with the sense of urgency to continue to move forward in reducing those gaps and building equity, you know, our Board of Supervisors committed to ending homelessness and built and adopted the county's first ever strategic framework for ending homelessness. And this was back in November of 2021. And I think one of the most common questions we've received from our central region community through our leadership team is, how does the county work with our city partners in addressing homelessness, and in particular in the city of San Diego? And that's a fantastic question. It's a great question. And so, you know, with the launch of this department, our Office of Homeless Solutions is the primary entity that's providing direct services such as outreach, case management, and emergency housing vouchers to individuals that are experiencing homelessness within the unincorporated area. But you know, San Diego County is also home to 18 incorporated cities. And so the Office of Homeless Solution Teams also leads outreach in those smaller city jurisdictions that don't have the capacity to stand up their own teams. But then for cities that have a very robust homeless response, such as the city of San Diego within Central Region, we closely partner with them to make sure that we can provide support and we can participate in coordinated outreach to provide services to any of the county resources that are available. And so the collaborative efforts between the county and the city jurisdiction really helps to build a strong and robust response system to homelessness. Again, going back to no one entity can do it alone. So as an example, and just kind of highlighting the partnership with the city of San Diego, in the Central Region, we've partnered closely with the city for many years, and we continue really to build and enhance this partnership in new ways since the department was launched. We're very close partners whenever there's a coordinated homeless outreach efforts led by the city. We also outstation our homeless solution staff in their emergency shelters, as well as with other community partners and providers like Father Joe's, to provide that direct link to our county self-sufficiency and other services. A couple other specific examples on the county working to expand emergency housing with the city is the recently launched Rosecrans Shelter and our Capital Emergency Housing Grant Program. The 150-bed Rosecrans Shelter was launched in September, and it was a partnership between the county, the city of San Diego, the Lucky Duck Foundation, who donated the structure and actually funded the installation. The county is providing the site, the utilities, as well as on-site behavioral health and self-sufficiency services and ongoing public health guidance. And the city of San Diego is providing the ongoing services and overseeing the operation. So again, really melding together that partnership and strengthen it to better serve the community. And then in 2022, the board approved the creation of a $10 million capital emergency housing grant program, which provided funding opportunities to the 18 incorporated cities to expand their emergency housing options. The city of San Diego was one of the cities who received awards for several different projects to expand their shelter bed capacity. And these efforts are just a couple of examples of the many ways that the county and city work in partnership to support one another in tackling issues related to homelessness. In addition, our new Office of Immigrant and Refugee Affairs has really begun building relationships and exploring partnerships with the city's recently developed Office of Immigrant Affairs. And our Office of Equitable Communities really continues to partner with the city and other community organizations in the Promise Zone initiative. Now, to really further illustrate our partnership with the city, we'd like to share with you some of the impact our Office of Homeless Solutions has had on Central Region, specifically during the fiscal year 2021 to 2022. The team made over 11,000 engagements with people experiencing homelessness in the city of San Diego, completed over 1,700 self-sufficiency applications in the field during outreach and at city emergency shelters. And again, this is connecting individuals to such critical services such as CalWorks or Medi-Cal or General Relief. And in addition, many individuals were connected to shelter and housing through other city efforts. But our Office of Homeless team was also able to connect over 850 individuals to shelter and housing through community referrals and outreach activities. The sessions, also last thing I'll mention on this is, part of being able to build the service and reach thousands of communities really is about leading close to 40 community engagement sessions and reaching thousands of stakeholders and people, especially who have lived experience. Let me see, I looks like I might need to slow down a little bit. My apologies. There we go. So jumping into the Office of Immigrant and Refugee Affairs, we've really hit the ground running with its community engagement efforts to support our migrants, immigrants, refugee and asylum seekers, regardless of immigration status. In October of 2021, We really worked with the refugee resettlement agencies and other key stakeholders to coordinate a response plan to successfully address the anticipated influx of Afghanistan refugees into the county. And then based on these efforts, the Office of Immigrant and Refugee Affairs convened a steering committee, which really comprised of key partners and stakeholders to identify different priorities, establishing work groups to address the needs of housing, behavioral health, social, emotional, cultural, and volunteer coordination. And currently, Office of Immigrant and Refugee Affairs continues to conduct community listening sessions to help shape the office. This includes virtual sessions, includes a weekend session, and everything from north to south regions. So really continuing to receive community feedback and making sure that we're getting valuable input by asking stakeholder what resources are needed in the community and how the county can help support the community-based organizations who are already trusted messengers and provide for these groups. So next, I'll dive a little bit into highlighting some of the work our Office of Equitable Community team does to engage with the community. So for over 2 decades, Health and Human Services Agency has really built relationships with the community through a model of delivering services regionally. And then with the pandemic, there was an opportunity really to reimagine this model and not lose those relationships that have been key over the years and proved vital really during the pandemic. So as such, our Office of Equitable Communities was really designed to not only continue the relationships, but really to continue to help them to flourish. So for example, our community health engagement teams continue to be active throughout the entire county, providing resources and information at community events. For example, schools will ask us to attend their events and provide services. There'll be a numerous amount of events that are happening in the community in which we're asked to come and provide critical information. The county has also brought on for the first time ever a new classification, which are county community health workers. And we're really excited about that. Our partners in the community have had community health workers for many, many years. And this is really to complement that great work that's happening already with our partners. These individuals are trusted messengers in their communities. They're able to help connect residents to services and resources. They're known in their communities, and it's about improving the quality and cultural competency of the service delivery. We also increased our community engagement efforts by bringing on 6 regional community coordinators, 1 for every Health and Human Services agency. Crystal Skirvin is on this evening from the Central region. And really, these coordinators are guiding and developing teams and implementing that community-based and resident-driven models of change. They're really critical in helping to facilitate the collaboration amongst our community partners and those who are part of our regional community livable San Diego leadership teams. And again, these leadership teams are looking at really addressing priorities and opportunities to improve equity and access in the region, all through data lens and in a very structured fashion. And so for Central Region, the leadership team is facilitated and led by Crystal Skirvin, our regional community coordinator, and co-chair Barry Pollard, who's the executive director of the Urban Collaborative Project. And super excited that this department continues to lead efforts in gathering the community input on the new Southeastern Livable Center. It's currently under construction. This Livable Center will not only provide health and social services for residents all in one central location, but it really is a vision that's come together from our community. And as a result of that direct input, many years of community's hard work, ongoing feedback, the new Livable Center will include not only our Family Resource Center, but public health, behavioral health services, child support services, military and veteran services, restorative justice services, that's going to be provided by probation, and then family strengthening services provided by our child welfare services. A state-of-the-art location and facility with easy access, and bringing in multiple older facilities into this one state-of-the-art location. And it's been designed really by the community. It's also going to have designated space for local community-based organizations to provide additional supportive services and programming. It does not need, the organizations do not have to be or need to be current county contractors. This is about having the space available for our grassroots organizations, our community-based organizations, whoever needs to have that space to provide supportive services. And then since April of this year, our office has been able to host 3 community input tours to continuously gather that community feedback on the exterior color of the facility, the sunscreen designs on the outside of the building, the name of the driveway leading into the parking structure, and the artwork that will be displayed through the building. We received over 700 community surveys. And I do want to take a moment to acknowledge the hard work and collaboration of the HSEC team, including Crystal Skirving and our agency's equity liaison, Elizabeth Bustos, who really have just been instrumental in continuing this community-centered work that started many, many years ago via our Central Region Live Well San Diego leadership team. And Dr. Warren, just acknowledging also the support that you've provided and getting the information out via the Voice and Viewpoint, really about everything that's been going on related to the Live Well Center for many years. So as we move forward with construction, our team is really continuously gathering feedback, providing updates on the building's progress. We're scheduled to open in the summer of 2023. And so with that, that concludes my presentation, and I'll turn it back over to you.
Thank you, Barbara, and thank you for that very informative overview, for the great work that HSAC and all that your team are doing, with equity at the heart of everything you're pursuing. And what a great shout out to end with. Mark your calendars, summer of 2023, the grand opening of the Southeastern Live Well Center. So excited for that. And I know that Dr. Warren shares that excitement. Barbara, it looks like you've definitely generated some interest for us, because we got a whole bunch of questions that came in from chat, and they've already been submitted. And I will read and ask you, Barbara, and feel free for you or members of your team to address them. Now, for the audience, if you haven't submitted a question already, please use the question and answer function at the bottom of your screen anytime throughout this discussion over the next 30 plus minutes that we're together. If you were not able to get to, if we're not able to get to your question that we have, since we're already flowing in questions in, our commitment is that every question does get response. So if you don't hear it on our town hall tonight, rest assured you'll get a response from us to your question. So with that, let's get started. So Barbara, your first question has 2 parts already. And the question is from Amy, and I apologize, Amy, if I mispronounce your name, Zamudio. Amy asks, what can we do about the hospital discharges back to the streets for people experiencing homelessness? And part 2, why can't the hospitals do direct referrals into shelters? That was our second part.
Thank you, Nick. Ms. Zamudio, nice to see you virtually on. And so, first of all, I know this is a complicated question, but California hospitals are required by law to conduct the discharge planning with the patients to ensure that there's a safe transition and there's not unsafe discharges. They do have a written policy that's updated annually that really attempts to ensure that they can secure a shelter location, that they're providing transportation to the discharge location. My understanding it's within 30 miles or 30 minutes, that the patient is offered appropriate clothing, that they're offered a meal, that they're provided appropriate health referrals to other resources. This is something that the county has been discussing as well. I know our medical care services department has really also been aware of this topic and connecting with our hospitals. One thing I do want to note is our California Department of Public Health is the licensing authority for the hospitals. So violations of the law really should be reported to them to investigate. And in light of all these discussions happening, the county is in the process of convening meetings to discuss that entire continuum of care for those that are needing the skilled nursing facilities or boarding care, and really having discussions with the stakeholders across the continuum. I know we've been in conversations as well, both Ms. Zamudio with yourself and some of the cases that have come up to date, and really trying to connect individuals to the appropriate services. But really the next steps include being able to have those conversations with the key stakeholders, including skilled nursing facilities, and the state of California, really to help streamline the discharge process for those that need that higher level of care. The last thing I noticed is we also are sensitive to those individuals that may not want to necessarily go into some of the next transitional housing that might be available.
Thank you, Barbara. I just will add, just because on this topic, that the Hospital Association is very committed, also working with the hospital partners, their individual partners, of ensuring that our homeless people don't end up back homeless on the street when they're in their hospital. So I know these are folks providing care, and doctors and social workers, they don't want to be putting people on the street. So we're working with as many of the hospital partners in that regard as well. And as I mentioned earlier comment, we need everyone's support and cooperation, particularly when we're dealing with our most vulnerable for homeless. So appreciate that question, Amy. Barbara, next question is from Brenda Huerta. She asks, what resources are there for unhoused persons in the South and Southeast regions of San Diego?
Thank you for the question. So different ways that we can connect individuals to some of those resources for the unhoused is we have homeless or prevention teams, homeless outreach teams that really can help access the shelter resources depending on the region, the location, and the availability. A couple of different options is if it's in the city of San Diego or the Southeastern Center, we can help connect them to the Homeless Strategies and Solutions City of San Diego. And I believe the team can enter that information on the chat. 211, calling 211 is always a great resource as well, because they have live number of either shelters or shelter beds that might be available. And there's some programs that 211 can take an application for, that's how it's set up. They can take applications for to get you connected to the right services. And then you can also connect with our Office of Homeless Solutions team for a referral, which we can then call you, get some basic questions and answers, and connect you to resources. And we're putting in the chat also on our website, our inbox, where you can send us an email or connect with us.
Okay. Next question is from Miss Nance. She asks about what support is there for a single male homeless? Where can he go with bad credit?
You were right, Nick. Lots of great questions tonight. So thank you. So first I want to start that, the best way to be able to connect someone, understanding and recognizing that every person has an individual special case that we want to be able to address, is we want to get them connected to an outreach worker. So this outreach worker is able to ask them key questions and identify what might be the opportunities, because every situation is unique, and we want to make sure that we can connect with the individual and make plans and a case management plan based on what their needs are. Couple of different ways. One is, again, through we have an email that they'll put into the chat. It's the HSEC, Office of Homeless Solutions, at sdcounty.ca.gov. We can connect with that individual, ask them some questions, and then get them connected to the most critical program that would serve their needs. The other service I want to mention that's not run out of the Department of Homeless Solutions and Equitable Communities, but really important, and we provide services, is homeless court. So homeless court really is a court that can help resolve barriers to housing. Sometimes it's about bad credit. Sometimes it's waiving some of the legal offense, minor legal offenses. Sometimes it's also getting them connected things like back support, back child support, getting a driver's license. So lots of different opportunities to address some of those barriers that may be impacting the individual.
I'll just, Barbara, add to your great response. We don't give no darn thing about someone's FICO score when they're homeless. We got to take care of them. And so, person with bad credit, we don't discriminate at the County of San Diego. We have a general relief program. They can qualify, helps them get food money so they get some food. And so, there are programs like our good friend Greg Knoll at the Legal Aid Society and the Consumer Center for Education that's on your side to help with those courts and other avenues to help someone down on their luck with bad credit. Ms. Nance, some folks of our homeless don't even have credit. So we work with all levels. And I just want to make that point explicitly clear. Barbara, next question came from Shalisha Almeida and Rick, and potent simplicity here, Barbara. They just asked, what do we provide and how do we share resources for the homeless?
Great. I think there's lots of ways to be able to get information and be able to get connected to the resources that are available. One easy way is just signing up for a homeless sector. So we have a very robust homeless sector. We're doing sometimes twice or 3 times a week, but if not, at least weekly updates on the different resources and programs that are available. In terms of also connecting to resources, I mentioned earlier, 211, our homeless strategies and solutions with the city of San Diego, our own sdcounty.ca.gov that also has a lot of the resources, lots of opportunities. I also want to mention the leadership teams that are happening in the different regions. That's a great way. Following our social media, connecting with our media folks. Our Voice and Viewpoint here at the table has lots of information. Dr. Warren just mentioned, the wonderful, really deep dive into the different efforts and services around homeless and some of that data that's out there. So lots of different ways to be able to connect. We did put in the information, Nick, I don't know if you can see it, but the team is doing a wonderful job of just entering into the chat the different sector blasts that are available, information that's available every day.
Thank you, Barbara. This next question is from Carl Rainey. And he asks, what will you do today for the poor and homeless in our town right now? He goes on, say the battle of the homeless to gain access to totality of the American liberties would be incomplete without access to public accommodations. There should be hope for housing, home. What is the 14th Amendment, which grants them full citizenship? What are we waiting for? I'm not asking you that, Robert, to answer the 14th Amendment question, but I think that the heart of it is, what are you doing today for the poor and the homeless in San Diego?
The teams that are out in the field, I just want to acknowledge them. We have these amazing teams and staff that are out every day. They're in the field. So they're doing the outreach, they're engaging with individuals, not only that are experiencing homelessness, but really also focusing on how do we connect individual to those key services. I think one of the things that we oftentimes hear is that getting more of the information out, and that's why this sort of session is so important, about those resources that are available. Using our multidisciplinary team. So again, acknowledging that it's not just one group, one entity, one department, or one organization, but it really takes that village approach, right? The different multidisciplinary teams to come together. Being able to, I mentioned earlier, being able to connect individuals to our self-sufficiency programs. What that means when we can do it out in the field is that we're meeting those individuals in their safe space, right? So we know they don't have to, someone doesn't have to take a bus to come into our family resource centers. Our family resource centers are amazing. They have lots of services, but if we can go out into the community and we can help connect someone. We've been out into the field and I've heard from individuals that they thought that they had access to medical services, but they weren't sure. We're able in the field to actually clear and see what was missing. How do we get them reactivated so they're able to get their medication? And so I think things like that are really what's important when we can do that out in the field. And when we can do it with our partners that also have built trust, when we can do it in multiple languages, when we can do it even on the weekend and in the evening, those are all really important. I know Dr. Bergman was on last month, and I just want to highlight the strong partnership and the amazing work happening with our behavioral health services. We are working lock and stack with our behavioral health services. So they are critical in that multidisciplinary team. And it really is about connecting the individuals that may be experiencing homelessness into that continuum of care. I mentioned the work that the award of the $10 million to the cities. I mentioned, the work that the cities are also doing is critical. Because we need to ensure that regardless of where you live in our county, that efforts are really coming together, resources are coming together, and different support services and opportunities. Recently, we launched the safe parking, our first safe parking in the county, in the East County, and it really was a compassionate emergency solution opportunity. And so that first safe parking, the reason that one is important is that we have a number of individuals that do have vehicles and want to be able to retain their vehicle. And this is an opportunity where they not only can park it in the evening and have a safe space with security, but they're receiving their meals. The meals are delivered there for them. There is security. So at night, if you're on a street somewhere in your car, you're worried about what might be happening around you. When they are in the safe parking lot, they have security. They can shower, they're accessing the different services, and they have case management. What does that mean? That means, again, we are tailoring individual case management plans for the individual based on their situation and meeting them where they're at when they're ready, in terms of the next step. We also have programs that are tailored specifically to our youth, to individuals with disabilities and justice involved individuals that are transitioning out of our justice system, ensuring that we can connect them to housing while they're transitioning out. So they're not going from the justice system into the streets, and then just really looking at how we can be innovative with the different approach to meeting needs of housing. And then January of this 2023, we will be launching an eviction prevention program. We also are launching flexible funding diversion program that really is about assisting individuals, meeting them where they're at, and financially assisting them to really remove those barriers to housing.
Barbara, appreciate that comprehensive response to Carl Rini. I'm just going to share, I think you answered this as well, but I want to honor the question from Bonnie Hill, who said, when are they going to get homeless people a place to live and get them off the streets? And I think you addressed that. I don't know if you want to add more to that, but we have other questions if you're good.
Yeah, the only thing I would add, Nick, is today there was such a robust housing workshop with a really strong emphasis on acknowledging, that blueprint that was approved by our board, really, in moving forward, and just really acknowledging that we have high cost in housing, very low vacancy rates. And so just knowing that the county as a whole is really moving forward in that.
Thank you, Barbara. Joe asked the following. is there any drug rehab available to those living on the streets to help protect themselves from a drug that causes a bad reaction? I have witnessed a man having trouble. The security guard told me that this happens all the time.
Sure. And Nick, you cut out a little bit, but I think I got the full question. So yes, we have substance and treatment, access assessment treatment available. Our outreach teams are connected with that in terms of being able to connect an individual to those resources. We can refer individuals into a program. The outreach staff does that frequently. Individuals can self-refer or call our access and crisis line. And if the team could help me by putting that number in there, it's open 24/7. I also, previously mentioned behavioral health services and that continuum of care and the services they have from outpatient to inpatient and assisting anyone that's seeking treatment. But I think the last, getting to the heart of what I understood the question is, we've been able to expand the outreach to include access to naloxone and the importance in that. I attended the Central Region and the South Region leadership meetings recently, and part of those leadership meetings was having the resources there available to be able to distribute the naloxone. So I don't know if there was anything else to add.
Nope, I think you answered that question. Thank you, Barbara. Next question's from TJ and Thelma Dunavant. Asks, what are all the options to keep you from getting evicted when you can't pay rent?
Okay, I think I heard the end of that. So what are all the options to keep from getting evicted when you can't pay rent? Again, every individual's, a set of circumstances is really unique. So we want to make sure to get them connected to the different programs that are available. 211 is one way where some of the programs are available. As an example, in the city of San Diego through the Housing Commission, there's a particular program that is sort of managing applications are taken by 211. Our county's housing and community development services also has an eviction prevention program. And they have tenant legal services programs, and those are currently operational, and we'll put that link into the chat as well. We also will be launching in the Department of Homeless Solutions and Equitable Communities in January. We're also launching a program that's going to help prevent individuals from reaching that legal eviction status, hopefully, by really offering them some of the services and the support. And then I didn't mention earlier, but we're excited to bring forward the shallow subsidies rental pilot program for seniors. That's expected to launch in spring of 2023. We have started an interest list. So for those who want to get on our distribution list to get updates about when we actually launch the program, what are some of the requirements around it, how do you apply? If you have questions, you can also email us and get on the list. And again, this is expected to launch in spring of 2023.
Thank you, Barbara. Next question is from Sabine Kepler. While the homeless situation always has been an issue here in San Diego, the question is, do we know the percent increase within the last few years and the possible reason?
So if we look at the point in time count data, we do have the data in terms of the increase. And for those who haven't accessed the Regional Task Force on the Homelessness, their website has robust data broken up into all different by regions or by different populations. The conversations, the robust conversations that we've really had both from the Regional Task Force and the different organizations that focus on this and the providers are really focused around, the need for housing, right? So the need for housing, the need for affordable housing, and also being able to identify those opportunities to help prevent homelessness. So when you look at the number of individuals that have newly or for the first time become homeless, what you're seeing is an opportunity to really try to focus those prevention services with those individuals. Working with the cities and jurisdictions is critical, and identifying the different innovative ways to meet those needs is also important.
Thank you, Barbara. Next question is from Lisa Evans. My friend is a disabled senior. Instead of a year, the landlord uses a 6-month lease and raises the rent in each renewal. My friend will soon be priced out. What can she do to prevent becoming homeless?
So I'm thinking about the different opportunities depending on the situation. And again, it's one where we really need to look at what are the different situations. Is this a senior, for example? Is there an opportunity also to engage the landlord? It just is going to depend on the different situations. I'm happy to sort of have that discussion offline if needed to try to figure out where we can get them connected to any particular services. Nick, you mentioned legal aid before, is there something there also that could be leveraged? Dr. Warren, I wasn't sure if you wanted to mention something. It looks like you're on mute.
Okay, I was very concerned because that particular situation right there is part of the very heart of the increase in homelessness, because San Diego does not have a sufficient remedy by law in terms of stopping rent increases. There's no rent control, and I've taken the position editorially that as long as we don't control what landlords do, they have the freedom. They slowed them up a little bit by stopping some of the evictions under the pretense of renovation, because the renovations weren't taking place. But the rents have gone up so much here that right now, and without Lisa's friend being a elderly person, the average person who wants to change residence in terms of apartments is looking at putting out a minimum of $5,000 just to change from one place to the other. When you consider the deposits and the increases, and we don't have a solution there. The moratorium during the pandemic was of some help. There were dollars left in the Housing Commission from the Emergency Assistance Fund that was put out there to help people pay back rents and all of that money did not get out. And the city did not push getting the money out until it got to the point that it had money left over. And so that's a very good example, Barbara, of what happens where the county is trying to help the city, but the county is a separate charter entity from the city, and the county does not have the legal authority to come in and override what the city does. So it can only be a working relationship. And I keep trying to help people understand that we're unique in San Diego because we're not a general purpose city. We're a charter city, which makes us as sovereign as the county. And so with all of the good work that you're doing, the great things that you're doing to help people, this is one of those situations where you really can't. Our Greg Knowles can't because it hasn't worked in terms of legal services. The tenant right people can't because a lot of the judges we have here are landlords. And they sit on the bench and make decisions against the interests of the people who come before them. And I'm looking into that and preparing to do more stories on it, and even suggesting that there be some complaints filed to the Judicial Tenure Committee on the behavior of these judges. So I think I keep saying this, there's a difference in San Diego between available housing and affordable housing. And all of the arguments want to focus on affordable housing, but the available housing, we have units sitting empty. Developers making money, writing them off. They don't want to rent them. They can't sell them with the interest rates going up, and we're caught. So the county is doing a phenomenal job. The city is trying to buy a couple of places, but the numbers of people that we have outpace the resources that are available. And we have people who do not want to move in off the streets. We haven't addressed that group. There's a group that will not accept housing. We have a lot of that in southeastern San Diego. People have pets, people have issues, and everybody who's on the street is not on drugs, is not mentally disabled. there are a lot of people who have just given up. We met, and I hate to take so much time with this, but I just want to inject this because we've had situations where we met a person who was having issues, and when we did a deep dive into their scenario, they lost their family in a car accident, and it was so devastating that they just gave up and walked away from business, house, and everything. So there's that mental component out there that's connected. So I didn't want you, Barbara, taking the heat for an element of this that you can't control. And I think the people calling know. I've shared it with some of them, and we just have to keep in front of folks the limitations that we have and the extent to which they've got to get involved as citizens in terms of helping. I'm sorry to take time, but I couldn't resist just addressing.
No, Dr. Warren, amazing insight, and your constitutional law and municipal law is invaluable. And it sounds like to me that this is a voter initiative that needs to be afoot.
It is.
On that. The next question, and I want to, Barbara, if I can squeeze in 2 more questions. I know we're approaching, and I appreciate, again, everyone, the audience, and everyone joining us this evening. But if I may try to get these next 2 questions in. There were several others. We won't get time, but we'll respond to those questions. But I think really tied to this one, we can't control the slumlords, but now this is my verbiage, sorry. But what can we do? And this question is from Cece. Is there a plan to provide permanent housing for people experiencing homelessness on city or county-owned land? Many homeless individuals just need a simple structure to call home. Barbara?
Yes, so the county is utilizing surplus land really to develop affordable housing, different variety of access of housing. There's multiple projects that are in different phases of development. So that is a commitment from our board in terms of utilizing that excess land and using it in a way that we can develop affordable housing.
Thank you, Barbara. And I will just add to say, today we had, as Barbara alluded to, a housing workshop where we actually talked about number of county properties and additional properties we're pursuing in the county, and we are also doing it with the city of San Diego. And I think that is a step forward, although as it's been noted, takes years and years to build these units. So there's a grave concern, in the meantime, as some of this stuff is on the horizon. But it is in motion, very importantly, and we're groundbreaking on events. So many more projects underway. So appreciate that question, Cece. This last question, I think, is all the questions have been great. I want to thank the audience, but this one in particular, I guess, great way to close it, Barbara. It's Tony Hawkins. He asks, why is it so hard to get the homeless help? And how can we as a community help? Love that question. Barbara?
Yes, and I think this really builds upon some of the comments Dr. Warren just had, right? So, first and foremost, showing compassion, right? Really showing compassion for our neighbor, for the communities that we live, work, and play in. Understanding that it really takes sometimes months or years to engage with an individual. And so, our outreach teams that are out there are not only county outreach teams. We have lots of amazing faith-based organizations, other organizations that are engaging with individuals in lots of different ways. Being able to make that connection, build that trust, build a rapport with the individual, to meet them when they're ready to accept the help. Dr. Warren mentioned it may not be today, tomorrow, the next day, but when they're ready, whatever that help is, how can we get them connected? I think also if our community residents and members can help really engage other community members when we're talking about the community, the different compassionate solutions, opportunities that are coming forward. So countywide, we've gone into the community to talk about, the safe parking or the different opportunities, even affordable housing, low income, for whatever that is, what are the different opportunities and how as a community can we come together to help support those efforts while addressing any concerns a community might have. Volunteers are always accepted. We love to have volunteers in the different efforts, and then supporting any of the community meetings and efforts around donation of material that's needed. But also our shelters, many in the city oftentimes also need that assistance and support with the volunteers. So I think those are just some of the different ways that I can think about. And I really appreciate the question.
Thank you, Barbara. And as we close this evening's virtual town hall, I want to thank you, Barbara, and your entire team for not just spending this evening, but the commitment, the purpose and passion in helping our community, especially our most vulnerable and our homeless and our newcomers, and seeking out health equity for all San Diegans. So thank you immensely. I want to thank everyone also of the audience for submitting the important, great questions and feedback, and again, for engaging us with this evening. I want to thank you all and wish you all a healthy, a safe, and a meaningful holiday. And in the spirit of the holiday, the best gift you can give is helping someone who needs a little help. And very people we're talking about this evening would greatly benefit from that. So my wish to you is to help someone in need in this holiday season. I want to also thank our great partner and appreciate Voice and Viewpoint for hosting, and my great friend, Dr. Warren. And I'll now turn to Dr. Warren for closing remarks. Dr. Warren.
Well, Nick, I would just like this to be considered part one, because there is so much to this issue that we didn't even begin to scratch the surface, and we are committed to it for the long haul. And the Voice and Viewpoint, Barbara, Nick, will do as many of these sessions as you want to do to answer these questions and to get people galvanized. We are running a series of editorials right now, reminding people that 49% of the residents in the county are renters. Not all of them are voters. In the last election, we only had 50% of the people vote in the county. And there's definitely a connection, as we've seen from what happened in Georgia, between the involvement of people who start voting and the results that you get. And so we have to bring that whole thing, and that's not your job, it's our job to motivate the community, and we will put your people and your programs out there. I'm so excited about the parking scenario where people are safe, and to know that they get meals and showers. So many people have no idea what it's like, and I've dealt with this with people who are homeless, whole families trying to live in a car, the city trying to impound a vehicle when that's the only thing that you have to get to work. And so we're committed to all of this. And just let us know, Tim, Barbara, Nick, whenever you want to do the follow-up, no special ceremony, we're right here to make it happen, because we're committed to this. Thank you.
Thank you, Dr. Warren. Thank you, everyone.
Thank you, Dr. Warren.
Thank you.
Take care, everybody.
Bye.
All right. Safe holiday.